Oh, hello, everybody. Thank you for being here. I'm Lyson D'Souza, so it's a pleasure to see you all. And I've been in the industry for 15 plus years, working as an interpreter myself, so with Portuguese and Spanish, and also as a trainer of community and medical interpret programs. So, I'm a language access consultant and currently the manager of language access for the UVM Health Network. So, thank you.
Thank you for being here with us today. Catherine, why don't you go ahead and introduce yourself?
Sure. Hello, everyone. Thank you so much for joining us today. I hope you find this topic as interesting as we all do. Catherine Adames, as the screen says, I am a CHI certified healthcare interpreter for Spanish. Started in the industry this is my 20th year. I've occupied operations positions, all that you can think of, supervisor, manager. I have trained interpreters, and it is truly a passion of mine to participate in everything related to language access. And currently, I am the director of interpreting operations at Effectiff.
Awesome. Thank you so much, Catherine. Michelle, go ahead.
Hi, everyone. My name is Michelle Chilstrom. I manage interpreter services currently at the University of Washington Medical Center. I've been there for, almost 6 years now. And before that, so I've been in the industry for more than 25 years. I started as a child. And I have worked primarily in the state of Minnesota. I worked at Children's of Minnesota, managing interpreter services, and also at Hennepin County Medical Center, which is one of the largest interpreting departments in the country, for around 7 years as well. And this particular topic is very interesting to me, and I'm very interested in today's discussion, and so glad that you're joining us.
We have a wealth of knowledge with us here today. Interpreter trainings and people that are experienced interpreters are the perfect subject matter experts for content like this. So thank you all so much for being here. We really appreciate your time today, and we appreciate you sharing your expertise and experience with us. So I guess if you guys are good, we can go ahead and jump right in. So our first question, again, we're talking about remote interpretation versus on-site. I know we all have some personal feelings about this. There's a lot of pluses, there's some cons, there's some things that need to be worked out, and that's what we're here to talk about today. So first up, how do patient experiences and outcomes differ between remote and on-site interpretation, particularly in terms of comfort and understanding for the patient and families? Michelle, would you mind jumping in here? I know you have firsthand experience interpreting, as you said, as a child, and that unfortunately happens all too often, even today. Can you jump in a little bit and maybe even compare your experience as a child interpreter and what we're dealing with today?
I'm sorry, I think you said Michelle, but you might have met. I never interpreted as a child.
Oh, I'm so sorry. Kat, apologies.
Yes. Well, I think it's the experience of many of us children of immigrants. I can tell you that in our experience, when it comes to first the operation world, we always like to ask the client what the topic of conversation is. And if we can get a bit of background as of what is going to be discussed, we can always recommend. But sometimes clients come with already a preference of what they would like to request. I would like to request an on-site interpreter. And when the interpreter goes there, obviously we provide the service. We then understand that those services could have been also provided remotely. I can tell you that it may first, let's talk about the patient first. So patients may have a preference as well, and also may depend on the language that they speak. A very common case that we're seeing right now in our industry is that all of the services that we may provide for ASL patients for comfort and also understanding, on-site for them is best. But we know that in the era of technology, and also maybe younger and more technology versed deaf and hard of hearing patients are okay with on virtual interpretation. So it may depend. For me as an interpreter, I can tell you that on-site always provides a more comfortable space for the patients, but it can also be very sensitive because let's say we are in a scenario where there is a woman speaking about their private areas and very sensitive subjects. They might prefer to have a virtual interpreter instead of a on-site interpreter. You know, I want to protect my privacy, I want to protect my body, I do not want anyone having any sort of access, without understanding that we as interpreters are also trained as where we have to be in the room and what we're able to see. But I am an advocate for virtual services. I know that it is faster. There is more access to other languages in the virtual side. And once, you know, again, I think it may depend on who is requesting the services. Like I said, you know, patients often feel more at ease with an in-person. Grandmas like mine, she felt better having an interpreter on site. And I guess I'll pass it on to Leson and Michelle if they have any other inputs.
So I think that we all can be friends, remote and on site. So it's not, usually there's that kind of a competition, and they see each other as competitors, and I don't think that's the way to go. When we think of what our patients need, so they, as we just mentioned, they need to make clear what they want in order to communicate. So that's the first step. But then you have also the system or the business needs, right? The business will say that, well, we need reasonable accommodations. And what reasonable accommodation means, it it can be quite different when you look at different parts of the country, or even healthcare systems in the same area. I think that when we think of remote interpreting, one thing that I really appreciate about it, well, two. So one, confidentiality. So there are situations where you have a very small community in that specific area, and you know everybody in the community. So for the interpreter to be in that encounter, and let's say that's a very sensitive topic, a week from now, people in the community will know, for whatever reason or way, what happened or what kind of situation that patient is going through. The patient will likely think that it was the interpreter because of this close relationship in the community. So when you have a remote interpreter, you can make sure that that's not the case, that it will be private, because the nobody knows each other, right? The interpreter, the patient, and nobody in the community. And I think that there is also, as you mentioned, the piece of accessibility, making sure that the service is ready for everybody everywhere. So, for instance, with the UVM Health Network, we just completed part of a project where there are 1,800 iPhones with interpreter services available. So then you add like 750 iPads. So you get this everywhere.
Wow.
On the other hand, there are situations where it is important to have that interpreter with the patient. So the way I see it, there is a great thing with remote. It's everywhere. It keeps things, confidential when you have that kind of a small community. But on the other hand, there are situations where you can and you should use this resource of on-site interpreters for both ASL and also spoken languages. So that's really important.
Yeah, absolutely. And as interpreter trainers, you guys know, and scheduling, you guys know firsthand that there is a shortage in interpreters, especially when it comes to the deaf community and sign language interpreters. So, that is something too that I think virtual can really help, because there's not as much, it bridges that distance between the patient and the services. So that's definitely, I absolutely agree with you too about confidentiality, especially in those small communities like the deaf community. Everyone knows everyone. And it might even be the interpreter was walking out of the building and someone saw them, and then they saw the patient walk out and they made their own, connection, their own situation. And just like that, it can spread. But absolutely, I agree with you guys that, virtual has a place and a time. And not every situation is perfect. I like the way that, we're talking about really analyzing the request that comes in and trying to figure out the best fit.
Yeah, I would just like to add, I think that there's so many great points that have been made so far. I think the most important thing is the access to language services, however they're provided. So whether it's in person, video, or telephone, they're all important. I liked how Leisan said we can all be friends. They're all very important pieces of the puzzle because we don't have enough interpreters to always have in person. Not all languages are even offered on video. So we need all of the different modalities to make sure that patients have access to care. And, in terms of patient experiences and outcomes, I would also say, I don't think there has been good data on differences in outcomes between the different modality. I think there's good data on accessing a professional interpreter, making a huge difference in outcomes for patient care. I do think for comfort, and for certain types of encounters, if you can find in person, it's wonderful. I do agree that in person is the gold standard whenever it's possible for those really critical types of appointments, end of life conversations, times when there's dementia or cognitive difficulties or hard of hearing. We do try, for example, at the University of Washington Medical Center for the first visit to have an in-person interpreter whenever possible.
Oh, wonderful.
It's not possible. So there's a lot of different considerations.
That's an excellent point there, that, when someone is there for the first time, there might be some fear. There might be a lack of trust, and having someone in person whenever possible can help to build that up so that you are off to a good start. I love that point. Thank you for sharing.
I would like to add.
Please, guys. Yes.
Go ahead.
No, go ahead, please.
Thank you. I would like to add that in our experience, when it comes to being the provider of services, it has come to our attention from the interpreters that at times there is some education that needs to happen, patient and user from the hospital. Sometimes people do not know how to utilize an interpreter, and it may influence in the way that the patient sees the services, as well as the staff member from the team. Back in the days when I started interpreting, we had something that was very important, and I think in trainings nowadays we have lost. The interpreters were allowed to let the participants of the call or the encounter know how it was going to take place. So I am your interpreter, and I am going to allow you to speak, but you need to pause so that I am able to provide all the information that you need. And this has been lost in trainings these days, and I think it made a big difference. And it allows us to let them know that we're there to help. We're not here to hear and say whatever you're in another scenario. Say what you are saying. I will be confidential, and I will make sure that everything you want to share is shared with the nurse, is shared with the doctor, so that they feel safer and more comfortable during the encounter.
And if I may add here, I see a couple of comments from Javier and Shayna. And I think I agree with them both, because one is, again, I'll go back to reasonable accommodations. So our goal is to have on-site interpreters for everybody, but that's not possible in most cases because of, first of all, we don't have interpreters, that can actually meet the number of patients we have for some language groups. Business, thinking of the business, right? Unfortunately, it is considered a business, so you have to think of numbers. It's really hard to balance that number. So we should educate patients that, hey, we have on-site interpreters, but you may need to use also remote interpreting, as part of your communication needs. And the other thing that we need to separate is ASL, right? So when we're talking about the deaf community, I think that on-site is the best approach in most cases, right? Of course, we have some, again, we go back to the patient needs. So the patient may say, hey, I want to use only remote interpreters. And I have some patients who are like that. and that's okay. It's part of our, patient's autonomy, communication autonomy. But then we need to have the system ready to support them. On the other hand, there are areas, and many areas across the US, where first there are no professional interpreters available. So how do we provide qualified interpreters to serve that population if it's not using remote interpreters? And even with we know how complicated, how complex the process is now to get more ASL interpreters ready for the field. That's an example, right, of the issues we have. So we really need to have remote interpreting. Again, we can all be friends.
Just one last point, very quick,
Please.
is that I also think in terms of comfort that patients during the pandemic became much more comfortable with virtual online communication. So I saw that as a game changer in terms of patients' willingness and comfort to use other modalities.
Yeah, absolutely. I think we all did, right? We're doing things like this today, and this is something that wasn't necessarily very common, before the pandemic. So I think we're all working towards that opening up and being accepting of the technology, while also, again, as you guys have pointed out several times, remembering there's a time and a place.
Yeah.
Anyone else want to add in before we jump on to the next question? No? Okay. Great conversation so far, guys. So what technological and logistical challenges have you faced when implementing remote interpretation services? So I know that, especially in the hospital setting, with virtual services, networking can be a big challenge. Having enough devices. Now, Lassant, I know that you have a solution there. You guys have hundreds of iPhones and iPads, and everyone's got one in their pocket. So maybe you could start with, talking to us about how you guys got to that point.
Sure, there's an iPhone for you and you. I think that the main issue is connectivity. So you cannot have remote interpreters or any kind of remote interpreter services if you're not closely working with IT. And in our case, it's the project. Actually, I've been with the organization for about a year now. They started this project before, right? So I think a couple of years maybe ago, they started the project to get language access across the network, and connectivity was the issue. So the main thing was to try to figure it out. Is there internet connection? And here we are talking about Vermont, upstate New York, and some areas where usually service should be great compared to other areas of the country. But even so, it can be quite challenging. So once you have the connectivity, okay, do we have the equipment? And it is an investment. So I can't say that, oh, that's super easy. No, it takes time, it takes effort. And also there are some very specific setups. For example, we have staff that needs that communication too. So what about team meetings where you have environmental services, for example, needs interpreter services for their meetings, their monthly meetings. So what kind of solution you can come up with for conference interpreting? It's not just about the communication that we have there with the patient, but also our staff. Because again, if we have issues with communication when it comes to environmental services, for instance, that's patient safety right there. So it's all connected. And I think that when I look at how systems are planning language access, we should and we need to keep our patients in mind, but we also must think about our staff. So that's another important piece of this of the service we provide.
Absolutely, especially in the hospital setting when safety is such an important part of the entire puzzle. Anyone else like to add? Michelle? Catherine?
Michelle, I think you're on mute.
Yes, I am. That's one of the phrases that we all say now.
That's true.
So I have implemented video technology at 3 different hospitals. And I have to say, over time, it's gotten so much better than it used to be in the past. So the technology that we offer today is, miles ahead of where it was 20 years ago. It does take partnership with the hospital IT, and they're much more willing these days to support the service because they provide similar services to other departments across the hospital. I think that it's very important, just to add to what Lisan was saying, to beyond just the technological piece, to look at the numbers of, which clinics or areas have more patients that may require interpreters, and make sure they have an adequate number of devices. We don't have all the cell phones, but we have a lot of different devices that are available. And convenience is very important, because the more convenient it is to access the technology, the more likely it is to be used. For inpatient areas, we typically always will station a device in the room with the inpatient who requires language services. So there's no reason for the providers not to be using the video when they go in and out.
That's great.
There's just some things to keep in mind.
You guys
Oh,
are, go ahead, Michelle. My apologies.
oh no, I would just say it's also important to continue to update the technology, because it, will break down or it becomes old, and we just need to make sure we can't just rest on our laurels. We have to keep improving.
You're completely right. You guys are touching on technology. And as you talk about technology, I'm thinking about training for the staff. Are they well trained to use the technology that we're implementing? And I think that's a very important part for the success of an interpretation encounter. And what we have also seen, and I always go back to what a language access plan is. Some language access plans these days have left behind an important part that was mentioned at the beginning of this conversation: your staff. Do they need the services that we're providing? They are our first clients, and sometimes that lack we don't fulfill. But also, have we thought about the part in which the patient enters the room? We've encountered situations in which a hospital does not have interpreting service from the welcoming part of the hospital. The person walks in, they don't know who they can speak to in their language. And I was a witness of this with one of our customers. I went to one of our clients' office, and I saw a person struggling from the security area. Some hospitals have security before they go into the hospital, and no one was able to speak to this patient. And of course, I, as an interpreter, had to assist. But we sometimes forget these areas, and this is part of logistics. We have to think of all areas within the hospital to implement, and for them to be informed that we have interpreting services. And when we think about interpreting services or language services, sometimes we tend to forget translations. Do we have the notices printed out throughout the hospital that these services are available? Or let's say directions to go to radiology. Is it in other languages, or most common languages? Are they printed out? So these are part of the logistics that sometimes we leave out and affect directly the outcomes of patients' relationships with the hospital. They may be late because there are no instructions for where they need to go. When we call the patient to schedule the appointment, do we already have an interpreter available for them to speak? I was in a meeting just this morning, and one of our customers was saying that their phones do not have a third-party connection available. Sometimes we forget about these things, and it may affect the total outcome of the experience for a patient.
That is an excellent point. And what you were saying about signage, that's the first thing that those patients will see when they walk in the door. And if they feel it almost immediately that, they're not going to get the service that they need, the help that they need, that can immediately kind of cut off that relationship before it's even started, that trust. Thank you guys so much. Anything else to add about this one?
I think to Catherine's point, I think that education is so important. We had a situation not that long ago where staff wanted to use remote interpreting for a deaf-blind patient, just to give you an example. So it's, I think that education has to be proactive. So you have to plan beforehand where you're going to, we don't have resources for, to use everywhere all the time. So you have to plan on how you're going to use training resources. And then there are, because the system can be so big, even if we are talking about a small hospital, there are many moving pieces, right, that we need to put together. So it has to be reactive, because when you get a report, when you get any complaints, or when, especially with our ASL users, right, the community is so they advocate, and this helps us a lot, because we get their feedback and we know what's going on in different areas of the system. So that is very helpful. Just to answer maybe one of the points, if waiting time can be considered a technological issue, I think it really depends on the vendor, right? Because it's not necessarily connectivity, but there are some languages. If in my area, for instance, our main language is Nepali for one of our hospitals, right? It's not Spanish. Every time I say that, oh, it's not Spanish. Yes, it's not Spanish. Nepali is the main language. And then it may take longer to get that interpreter than it would for a Spanish. So I don't think it's necessarily a technological issue, right? But it could be part of the process.
You're absolutely right. You're absolutely right. And I think education, again, when we have these conversations with clients, I like to be very truthful. There are languages that we're able to service you within 3 seconds. Of course, Spanish, Portuguese that you speak, Haitian Creole, and many other languages that are very popular in our country. Actually, Nepali is one of our top languages. But then there are other languages that will take some time. And it's not technology, it's just that interpreters are always busy. Right now, it's like no breather for the services that we're providing, especially in the medical field. And we also want to think about 911. Sometimes these services are needed right there and then, but the possibilities of telling you that we will answer you in 3-5 seconds for real languages is just impossible.
Yeah, such great points by Catherine and Lisanne. I just wanted to add in response to one of the questions regarding the CDI. I think that it's very important to have that available by video also. As Lisanne said, it doesn't work to necessarily it never works for a deafblind patient to provide a video service. But we have had situations where we will provide an in-person CDI for a patient who is deaf and blind, and then they will provide the CDI will provide the ASL, and then the video interpreter will be able to interpret for the ASL portion. So sometimes it's a partnership. It is very helpful to have CDI available also on video, because sometimes we do have patients who have limited language in ASL, and it's very helpful to have the CDI available. And sometimes we have both the CDI and the ASL interpreter on the video. Sometimes we have one or the other in person if possible. So it's really an interesting dynamic.
Excellent. Thank you guys so much. Yes. I love that you, brought in the CDI conversation, and we're looking at all the different perspectives here, because everyone who uses services are impacted. So thank you guys so much for that. Let's move on to our next question. How would you determine what scenarios or contexts on-site interpretation would be essential for? And why might it be preferred over remote options?
I guess I'll start here.
Perfect.
As part, and I always go back to education. Sometimes the resources are limited for our clients. Sometimes all they have contracted is virtual, right? But people with the experience that we all have will have the right questions to ask when a request comes in. For example, ASL. Our schedulers would ask if there are any specific needs, if they have any other condition, and we will determine there and then if it will be best to send an on-site interpreter or provide a virtual interpreter. Also, there may come assignments in which the language will be nowhere to be found for on-site, and we will directly state to the client, unfortunately, in your area, this is not a common language, and we will not have a resource for you. But this is, when it comes to the staff. But cases, there are very sensitive cases, and in my experience, any case that has to do with mental health typically are requested to be on site. But there is an error that we have seen, and it's the fact that sometimes requesters think that interpreters are able to provide an opinion of how the person looks, of how well they are speaking, if the interpreter is able to determine if they're using drugs or if they're under the influence of anything. And we're not. We're only there to provide information. And when I used to train interpreters, I will tell them that they needed to say that up front. The interpreter is not allowed to provide their opinion. I'm here just to say whatever your patient is saying. But I know that for sensitive cases, interpreters are best to go on site. However, there are other sensitive cases, like, for example, sexual abuse, and other subjects in which the patient would rather have someone virtually, not even through camera, just voice, because they feel that whatever they're discussing is more private. No one is looking at me and knowing my and seeing my face, and I am able to say whatever I would like to share to the doctor, and I am not being judged, because this is something that is also determined. I think as language service providers, it is important that we ask the right questions for the cases, but sometimes we don't have that time, and then also the healthcare providers don't have access to all the services that we're able to provide, for example.
Yeah, such
Excellent
important
point.
points. Yeah.
Mhm.
So at UWMC, we have like a list of departments and areas, for example, MRI, where we always try to provide an interpreter in person, or
Mhm.
types of visits that are um, end of life or really serious, could be a care conference where we always try to have someone in person. Sometimes it's not possible, and it's always better to have someone, even virtually, than no one at all. I guess one thing I would like to mention is, just to piggyback on something that Catherine had said, is the importance of training. And I will say, not just for the interpreters, but the providers as well. One of the things I have noticed is sometimes when we assign virtual services instead of in person, it's more likely that the provider will access a family member or try to, especially if they speak some Spanish, to get by. Um, and so when there's an in person interpreter, typically they advocate more for having the interpreter stay. So that's just another component to be aware of.
Very good point.
And yeah, I agree with all that was just discussed. I think there are some specialties that would just do better with on-site interpreters, and I could mention psychiatry, oncology, end of life. So there are some specialties, but even let's think, for instance, about psychiatry, right? You may have on-site interpreters may be a solution for some patients, but then with others, there is the issue of interpreter safety too, because that's
Yeah.
something you have to take into account.
Yes.
So
Absolutely.
in that situation, remote interpretation would be the best,
Yeah.
just to preserve, our interpreter. I think it really depends on the patient. It's so hard that we don't really have a solution for all the issues, because it is the way it is, right? I think that it depends on the circumstance. Um, there, I notice a trend, and I think we don't really have much research on this, which is interesting for many different things about interpreting. There's no research available, but it seems that with the remote interpreter, there is some sort of dehumanization, or they don't see the interpreter as fully human. They
Yes.
see the interpreter as a machine. So that's why I may feel more comfortable talking to my provider, or the provider to patients. But then in other circumstances, like, oh no, I need a more personal touch. But again, it's a human in both settings. So it's just interesting to see how patients and providers react to this.
That is so true. That there's something different about having that person in the room with you. There is that feeling of, this is another human. They're here. They're helping me communicate. They're supporting me, even though the interpreter is drawing that line for professionalism and whatnot. But it's definitely something where the device creates more distance. It's a colder interaction. Um, that's a very good point. It's very interesting. And sometimes that's the best. I think that wrapping all the way back around, the most important thing is getting those preferences from your patients, and, really listening to their needs and understanding what their families are saying, and, definitely it's important to get their preferences.
Yeah, I would also just say that some of our staff interpreters also do an incredible job working on video, and they're able to create that kind of rapport even remotely. But it can also be, I don't know, just psychologically, interpreting can be really challenging. And I think sometimes being treated as just an object on the video or phone is also difficult for interpreters as well.
That's
Um,
very true.
it is very true. And I can tell you that I always advocate for the work that I love to do and that I know many people do with so much grace. And to make sure that interpreters never feel, let's say, worthless because of the work that they do, I explain to them that without them, conversations wouldn't happen. A person
Mhm.
is diagnosed with a certain condition, and you're there to make sure that they understand everything that they need to know. If you are not there, the outcome will be totally different. And also, sometimes when there's, for example, an angry patient, just always keep in mind that they're not angry at you. They're angry at the situation that they're going through, and your job is just to make sure that you portray that. However, like you said, psychologically, it could be tough. So, what do you do after you have a tough call? Log out if you're virtually interpreting, or take a walk, watch some TV if you're working from home. For peace of mind, I always go back to COVID times. All the calls that we were taking, and I was interpreting at that time, were negative calls. We were, informing someone that there was a patient on the call that was losing their life, and unfortunately, you were not going, as the family member, you're not able to see them. Take 10 calls like this, it's going to affect you. You need to do something, and interpreters need to have tools to make sure that it doesn't stick with them. I was having a conversation with some partners the other day, and I told them that it's so graceful to understand that interpreters use their short term memory, and the fact that sometimes we go through so many challenging calls. 2 hours later, maybe I will not remember this call because I'm working on short term. Whereas there are things that really touch me, and I can tell you from 10 years ago exactly what happened during that conversation. And being a person that has interpreted in all scenarios, I can tell you that when you're only using your voice, yes, you lose kind of that human touch, and the person maybe doesn't see you. When you're able to see the person and see their face expressions, it also helps you to portray their expressions and their feelings. And when you're on site, that's just a wonderful world of things that may happen during that encounter. So everything has their pros and their cons. I think we need to be resourceful. And going back to the question we should ask when it comes to us language access providers, the right questions to make sure that everyone is comfortable with whatever service it is that we're providing.
And that to your point, it's harder to be, as an interpreter, it's harder to be exploited if you're remote instead of on site. And by
Yeah.
exploited, I mean if you go on site, as I've been, I've done that multiple times. You go on site and they're like, "Hey, can you see?" Like, you go to school, can you see with this family and fill out 400 pages of
Yes.
forms with them, and translate this handbook
Mhm.
to to the family, to the person, or at as we just mentioned, like during the medical encounter, can you can you assess language, make sure
Yeah.
that this person is, I'm not a speech therapist, I'm not specialized, but then when it is remote, it's harder to do that. So how are we going to ask to site translate a
Yeah.
document, right? How are we
Mhm.
going to ask to fill out forms? So again, there are pros and cons. I think that the fact that sometimes when you're remote, you feel not as human, can also be helpful, that you're not asked to do things that are not in your scope of work.
Yes. Side
Absolutely.
translation is a big one. And we see this all the time in both scenarios. You mentioned education, but we also see it in the healthcare industry because of lack of translation services. So you have an interpreter there with a form in English. Oh, can you please translate this for the interpreter, for the patient? Okay, but I'm the interpreter. And they don't want to say no.
Yeah,
Truly, they want to be able to assist the patient.
absolutely. at the end of the day, that's what we're all here for. That's what this is about, is making sure that communication happens and that our patients' voices are heard. Thank you guys so much. Anything else to add about this one before we move on? Awesome. Guys, this conversation has been so great. Thank you so much. So the next question, what would be improved or updated in various remote interpretation solutions, including video remote services, and why patients in many cases still prefer in-person interpreting, even in the post-COVID era, when remote interpreting is everywhere?
I would just say for VRI, I would like to see more languages available. Some of the rare languages are not available typically on video, and that would be wonderful. And I know my colleagues will have great additional points to make, but I would just say there will be some people who prefer in-person always because it's just more comfortable for them. But in my experience, the majority do accept virtual solutions as long as it's high quality.
Yeah. Excellent. Thank you.
I think that what we've heard meeting with many clients is that sometimes the technology that a service language provider brings to them is not user friendly, and we want to simplify things. We want to make sure that the staff knows that they just need to press this button or call this number to provide services. And we bring those solutions, but sometimes they're not enough. To make sure that we're able to also tag along with your systems. This is something that is happening more now, but I know that it was not possible before. And touching on what you said, Michelle, based on the rare languages that are not available in video, sometimes it happens that these interpreters that we're able to find for rare languages don't have the training needed for just different scenarios. And at times, we don't have those languages available in the US, and technology for them becomes a problem. There are many, let's say, African dialects or Mayan dialects that we're not able to find within the US. And they may not have the training that within our laws are accepted or acceptable for them to certify, but our job is to make sure that the services are provided. So we sometimes need to accept maybe whatever the interpreter is able to provide, and make sure that we as LSPs also provide some sort of training to them so that we're able to provide to you. And I've said provide like 10 times, but in reality, that's at the end of the day, that's truly what it is.
And I think that connectivity, is fine. So there are many points that are just fine, but quality has to improve, and quality of interpreters. There is still a gap in the industry when it comes to where we want interpreters to be, being professional and accuracy and so many other standards, and what we have to work with. So I think that when it goes to quality, and it goes back when we see the standards for ASL interpreters, right? It's just amazing. It's beautiful. We know that for spoken languages, it is harder to implement such a thing for everyone. But how can we make training or some sort of standards well established across the industry, so that everybody who has, because we may have wonderful services from one organization, one vendor, but not the best from the other one. In the end, the patient will be affected by this. It's their communicative autonomy that will be affected. So I think that quality is the real issue now. Getting great interpreters or forming new interpreters who will be great in the industry, when and not having this gap between what we have for ASL and what we have for spoken languages.
I've had a different experience. I've had a rough time of recruiting and hiring ASL based on their standards than actually hiring spoken language. And the reason for this experience is that we have a shortage all over our country of ASL interpreters, and the demand is so high that sometimes the training that one interpreter brings for ASL may not be enough. Yet, we are, and you guys need to provide these services. And also, it becomes so hard for an ASL interpreter to certify that organizations like yourself understand this, and they say, you know what, they don't necessarily need to be certified to be able to provide the services. Whereas for spoken languages, our experience has been that we have great interpreters. They're so well trained. I love to remind our interpreters that we have ethics, we have codes, and we need to abide by those. And it's going back to the basics. You're a conduit. After that, you're a clarifier. And if you need to be a cultural broker, then be it. But it's very simple. And I am going to always make sure that the interpreters that we provide have the quality needed to provide the services that they're contracted for.
This is such an excellent point. Actually, both of you are correct, in my opinion, that I have seen over the years, from 25 years ago, the quality and access to training programs for spoken language is so much better now than it was in the past. There does still need to be, especially for those languages of lesser diffusion, more access to training. Sort of to Catherine's point a few minutes ago, some of those rare languages, there is a difference between their knowledge and skills because they haven't had access to that same training. And yet I also agree, sign language interpreters, yes, they have great training, but sometimes that training is a barrier to having enough interpreters available to meet this. So there needs to be a little bit more of a balance somehow. And so I agree with both of you, and it's an interesting challenge.
That's absolutely true, especially when it comes to the sign language interpreting test. There was a period of time where I actually was a sign language interpreter for a long time, but the test itself closed down because they were going to be, rewriting and updating it, which was necessary as well. So because of that gap, we're seeing that, we're starting to be impacted because those interpreters that were young interpreters ready to take the test had to wait. So that delayed their career and their experience that they were able to get, and it was just kind of a chain effect.
Yeah.
Going back to quality, I think that also, and we discussed this on our last webinar, and I can't remember who said it, but they said being bilingual doesn't make you an interpreter. And sometimes some LSPs may hire someone just because they're bilingual. It takes a lot of training to become an interpreter. It's not only that 40-hour training that you get, but also in our code of ethics, you're told to continuously learn things because technology is changing. Language is also changing, and a lot comes in play. Looking at the second part of our question, I think we have answered this before, maybe with all the questions that we've had. I think it's a human touch, and also in the sense of why patients in many cases still prefer in-person interpreting, even in post-COVID era. It is a very personal thing, and they will know why they would feel comfortable. And also, I think that organizations and LSPs like ourselves need to continue advocating for video remote services, letting the community know and letting everyone know, hospitals, that technology is changing and that we are working to making sure that internet is better, that you know where you're going to locate the resources that we're providing for you, that you're able to use this website, not necessarily an app, to access services, that you're able to access this through your phone. If you're not able to access through a phone, you can access just calling a 1-800 number, and that the technology that we use is easy and it doesn't load your internet as much for you to be able to access the services that we provide.
Absolutely. So guys, we have time, I think, for maybe one more quick question. I don't see very many questions coming in through the chat. So the last question I think that we'll be able to get to, what best practices can healthcare organizations adopt to optimize the effectiveness and reliability of both remote and on-site interpretation services?
Well, first of all, you have to have a policy and a language plan, and you have to have
Absolutely.
the resources available. If you have a large number of patients who speak other languages, you should have staff interpreters for the top languages that you serve. And you need to have contracts with adequate video and telephonic service vendors and the technology in place to make sure that all the needs are met.
And adding to that too, I think that the connectivity is basic for remote interpreting, but then quality monitoring all the information you can. It's tricky for remote interpreting because you're not able to record sessions, so you can't really see what's going on. Compliance, right? But I think that you need to monitor feedback. So all the ratings that the calls get and everything that's going on, as a language access manager or whoever is coordinating the system needs to be well informed about what's going on with the system. And for on-site, peer observation is key to there's a lot of I like the term peer observation better than shadowing because of what it entails. That's actually getting this active learning from both.
I love it.
No, it works great in the sense that sometimes you get a complaint which is not necessarily a real complaint, and you have the chance to see what's going on with that interpreter. You can define some priorities to develop that interpreter too, and you learn from them. So they are out in the field, right? So they know what's going on in different places, and you can get that wealth of knowledge and apply that into training or things that the community actually needs. So both will work fine when they can work together and we can monitor. I think that's key. Just track data, but also use that, not just like observing what's going on, right?
Yeah, I think you both are describing a language access plan. If organizations, not necessarily healthcare organizations, can go step by step and understand that each part of those is important. But even before that, I think we all need to understand why providing the services that we have to service are important. The law states this, and we have to do this. And also make sure that the receiver of the services understand that it is their right to receive these services. We need to assess the needs of our organization, like Layson was saying, and I think I'm saying your name in French for some reason. But we need to assess the needs not only of our patients, but also of our internal clients, our staff. What are the languages that we need? Because sometimes we may be surprised and start receiving. It happened recently in one of our communities. They started to receive a lot of requests for Haitian Creole, but they didn't know the background of this. And so if we are assessing the needs and understanding our community better, I think it will make it easier for us to learn and to understand and to know what necessarily we need to offer.
I agree. The last thing I would just say, which was hit on also, is how important training is for the providers and other staff on accessing services for patients. They need to know the laws, how to access services, and the potential outcomes that may be impacted if those services are not accessed.
Yeah, absolutely. One thing I will say about the deaf community versus the spoken language is that the deaf community often, when they're children in school, they're taught specifically advocacy skills as well as their rights. And that's something where, they become adults, they know that you have to provide it. They know that, they have a right to understand what is being said and what's going on with their health and among other things. But, that's the difference is we have people that come here and they need a language access. And sometimes they're just so accustomed to, there's nothing extra for you. Like you get what you get. And they don't realize that actually you can say, I need this, and we will provide it. Yeah, education is so important.
Yeah, sometimes fear of retaliation and other things.
Yes.
Oh, yes.
Yeah, or just being turned away. Like, sorry.
And I think that's, sorry.
Go ahead,
No,
please.
just to say that that's why I think that I love the way that the deaf community is um, passionate about language access and how they advocate for their rights when compared to spoken languages.
Yep.
So if those who actually need language access, who use spoken languages, right? If they were as vocal and as active in
Yep.
advocating for their rights, things would change a lot more in the
Mhm.
whole system, because sometimes they're not even aware, they don't think they're they can actually use better services.
Yes.
And I think that's key to it. It's just okay, I got the phone interpreter, oh okay, nice, but no, I could have video remote interpreting, or
Yeah.
for this specific session procedure I could have an on-site interpreter. And
Mhm.
there sometimes it feels that the communities can be more passive.
Yes.
Yes.
Absolutely.
It's a cultural thing. And what we've seen sometimes is that sometimes the people of spoken languages that are in need of services may have a different status in our country, and they feel afraid to voice.
Absolutely.
So for one, you will see me saying to my, family, if you speak Spanish and you don't understand, just say, I need an interpreter. To my mom, even if I'm an interpreter, mom, you go to the hospital, tell them that you need an interpreter. And at times they're just scared to voice because things in our country were different a few years back. And, they didn't have the privacy and all of those beautiful things that the law now abides by and protects many people. Whereas typically the ASL community has a different status. And for them, that's not a worry. This is my right, and I know that I can voice it, and I will get an interpreter. Layson said
Absolutely.
something earlier, and I want to just speak on that. When it comes to quality of the interpreters on the medical field, we are not able to hear the calls. And before, in organizations that I participated in, we were, and it was easier to provide feedback and train the interpreters. But if clients only knew how important it is for us LSPs that they rate the calls and that they provide
Mhm.
feedback with the important information, it will also allow us to create better trainings to make sure that the interpreters that we already have available know their flaws and work on their flaws, instead of just saying, oh, they're a terrible interpreter and I don't want them anymore. Allow us to also work with them and make sure that they're providing you with the best service that they have available.
Absolutely. Yeah, thank you guys so much. We're actually a little over time, so I'm going to go ahead and wrap this up. Thank you everyone for joining us. Thank you for your insightful comments to the attendees, and thank you so much to my panel. I appreciate all of your wisdom and your experience that you're willing to share with us today.
Thank you so much. And
Truly a
thank you
pleasure.
everyone for
Thank
attending.
you.